Hi everyone, my name is Dr. Rola Rabah. I'm an oral maxillofacial surgery resident, and today is Halloween. This is one of my favorite holidays to celebrate, hence this mask. However, this has been a really strange Halloween. First of all, it snowed all day yesterday in Boston, making it an interesting start to this Halloween. And second of all, I am actually working night shift. So I am heading into the hospital right now, and I decided to take you on a journey with me on this night shift on Halloween night, because I imagine that we are going to see quite an interesting night. People make strange decisions on Halloween, and so the hospital will definitely be interesting, and I'll take you along with me to show you some of the things that we might see. I'm not working trauma surgery, fortunately, but I am going to be on general surgery, so we'll see what we have ahead. But it's 5:15 and sign-out's at 5:30, so I'm gonna head in now and we'll see what we have in store. Let's go.
Do it.
Thanks, Zach, for signing out. Now go home.
What's a sign out? You're crazy. Am I still on this?
Yeah.
Oh my god.
You gotta leave.
I'm leaving. Adios.
Bye, Zach.
Have fun.
Have a good night.
You
Studying for...
You get to work an extra hour tonight.
Oh, man. Have fun studying.
I won't.
Bye.
I'll see you later. Goodbye.
Tonight I'll be covering the surgery oncology service, the minimally invasive / bariatric service, the colorectal surgery service, and the vascular and transplant surgery service. There is also pediatric surgery service, but there's no inpatients right now, so will not be holding the pager for them. Basically, this is quite a bit of services to cover overnight, but because it's the weekend and a lot of these are general surgery subspecialties, we actually only have inpatients, not a lot of surgeries that are scheduled on the weekend, because a lot of them are pre-scheduled, and so over the weekend it's not too bad. Usually there's one intern that covers the daytime, one intern that covers nighttime, and at night patients go to sleep. There's not too much to do, but since it's Halloween, I have a feeling that it might be a little bit more interesting. Okay, I am a little bit biased, but I absolutely love my mask. I think it's so cool. Blood splatter all over. It's very dramatic, and it matches my blood splatter nail, so you know, it's like a whole look. But I'm starting to think that it might be a little too much, because the blood on here still looks fresh. Like, look how shiny it is, even though I put it on a couple of hours ago. But I use this really awesome costume paint that I had from a couple of years ago when I did another Halloween costume, and it's staying on so well on this mask and just like looks really fresh, like real blood. So I don't know how the outside world is gonna handle this, so maybe I'll wear it for a little bit and see the response that I get. I was thinking of bringing the blood and like putting it all over my scrubs and kind of like fabricating a scalpel on a headband and putting it on, and then I was like, wait a minute, that's way too much, especially when you're working night shift on Halloween in the hospital. It's like a little scary, so I stopped myself. But that does sound like a really cool Halloween costume, like outside the hospital, maybe at a party when things are back to normal and we don't have to deal with COVID. We'll see. Maybe I'll save this idea for next year, or maybe you can use it for a Halloween party. Don't worry, I'll link everything below, including this awesome costume paint. Okay, so I was checking on one of my patients, and his nurse comes into the room and she literally like jumps back and she's like, you need to change your mask. I think you have blood on it. And I looked at her and I was like, oh no, this is just for Halloween. And she's like, oh my God, it looks so real. I was so scared. So I took off my mask because I was like, oh, this is probably not a good thing to wear around the hospital on Halloween when you're a surgical resident, especially since it's dark and sometimes I wake patients up and they probably don't want to see that. So I took it off and now I have this boring mask on. Maybe next year I'll think about doing something on my head or something a little less morbid. But I think this is really boring. So if I get a minute, I might do something else. We'll see. Ta-da! Quick fix. I have been transformed from a blood splatter mask into this much more friendly cat. I do have to say though, you guys, even though I'm really in the Halloween spirit and I want to go walk around and do my PM rounds and check on the rest of my patients, I have a feeling that this is not going to last very long because I'm already starting to get a little dizzy from this permanent marker fumes all up in my nose. Didn't account for this problem. But, you know, I'm a Halloween trooper, so let's see how long this is going to last on. I have a feeling it's not going to be very long because I don't want to pass out. I'm like the only intern covering these services. I got to be there for my patients. Failed Halloween mask number 2. What will I think of next? All right, so it's about 3 a.m. and so far the hospital has been kind of eerie and very quiet. I don't know if it's because it's Halloween night or if it's because it snowed on Friday and it's super cold, but so far so good. Let's hope it stays that way. Probably my favorite decor in the hospital is these 2 little guys. Look at this little skeleton in scrubs. And this one here, so freaking cute. Best part of the night, a little break in the on-call room to grab some snacks. Which will it be today? Cool Ranch Doritos, classic. Sea salt and vinegar, never go wrong. Cheetos, I'm a big fan of hot Cheetos, but I don't do the cheesy one. Or apple, old looking banana, and an orange. Definitely going for the Doritos. Yep. Just got paged, you guys. I have a patient screaming out, calling for their deceased mother. I have another patient who needs an NG tube and 2 other patients who are in a lot of pain that I have to go see. So my shift is almost over, but it looks like Halloween night is in full effect and it's a full moon and everybody's just falling apart. Here we go. All right, you guys, all done with my Halloween night shift. In general, the night wasn't actually too bad. It just got a little bit hectic towards the early hours of the morning. So around 3:30, 4 a.m., my pager just kept going off. There were a couple of traumas overnight. There was actually a trauma where OMFS was consulted. So some of my colleagues went in to go see the patient. And, you know, I realized that I actually worked an extra 1 hour today because it was daylight saving last night. So that's unfortunate, but I am feeling pretty tired. I'm gonna head home, get some sleep, and then I work 1 more night tomorrow, but it won't be Halloween. I think it is a full moon though, so we'll see what tomorrow brings. Have a good night, you guys. Don't forget to like this video, subscribe to my channel, comment below, let me know what other vlogs you want me to record, and follow me on Instagram at 15 Blades for daily posts like this and more. I'll see you guys next time.